She's very polite, the woman who announces recording. So thank you very much for being here. I appreciate this opportunity so much to speak with you about your brain fog and your fatigue and your lack of endurance. This could be something that came on after having had COVID, or maybe you're someone who had a poor response to the vaccine. Everybody's different. Maybe you haven't had COVID or the vaccine, and you're still someone who's dealing with brain fog and fatigue, and you would like some help with that. So over the last 2 years, I would tell you, we've seen lingering symptoms with people who've had COVID. And some of them were folks who had poor responses to the vaccines. That include things like brain fog, searching for words, fatigue, not your usual fatigue. Also, we've seen cardiac issues, different heart rhythm issues, new diagnoses of diabetes, like poor blood sugar regulation, blood pressure problems. Let's see what else. Gut problems, that's been a thing, not realizing that the new digestive issues were actually coming from some of what we're going to talk about today. Thyroid issues, also really big. And then weakened immune systems. People finding that, geez, now I'm getting every cold. What's going on? So these are just a few of the things that we've seen in our office over the last couple of years. I've been in practice for 22 years, and I've been so excited to have a method to be able to offer people that has been able to cut to the underlying issues for why someone may not be fully recovering. So I would actually, if you have the interest, if you want to type in the chat a health issue I haven't mentioned that you hope we talk about today, please type that in the chat and direct it to me, and I will make sure that we touch on that so that you get some value out of today. It's incredibly frustrating to still have the fatigue, right? You try all these things and you think you're doing all the right thing, and it's still not gone. And in my experience, what I've noticed with people who come here, most people have tried at least 2 to 3 different things with their healthcare practitioners, trying to handle these lingering issues. Many people have already changed their diets because, sometimes food can be part of what's keeping you from healing. So you clean it up a bit and stop eating too much sugar, alcohol, whatever. Increasing your water. Many people have already paid attention to hydration, go to bed earlier. Sometimes that'll break a cycle of fatigue and brain fog. Hello, Alan. So lots of people have been dealing with going to their doctors, looking for help, and in their practitioners' efforts to help, they've run some blood labs. I just want to mention that one of our participants is saying very little sleep, can't sleep well. And that's another issue. I've found over my 22 years of practice, inflammation can be a reason people aren't sleeping. So if it's new to you that you're not sleeping well, this conversation could also be helpful. So blood labs, sometimes people are running blood labs. They're looking for thyroid imbalances, maybe low iron. Those are both things that could cause fatigue or brain fog. Blood sugar, if your blood sugar regulation is off, that can be a reason. Infections like hidden infections, autoimmune problems, you can run blood labs to look for those markers. A lot of my colleagues in our community here in Burlington and Chittenden County and Vermont in general, awesome collection of collaborative doctors trying to help figure things out, running these labs. I've had people seeking cardiac evaluations, going on blood pressure medications. Let's see, it seems like somebody got booted. It's coming back in. Okay. Chest x-rays, looking to see, is there something going on in your lungs that's not allowing good oxygen? Some people are going through scoping of their guts because they have a digestive issue or what seems like a gallbladder problem now, and they can't figure it out. And then, low energy, fatigue, poor memory. Sometimes we start to wonder, is it depression? So some people are trying, anxiety and depression meds. Other people, that focus is not there. So they're trying ADD, ADHD meds. If there's something you've tried and you want me to hear it, you can type that in the chat. But today I want to show you that you might be missing something. There might be some key things missing in the approaches that you've tried so far. And I want to show you a unique way to go find out what those missing pieces might be and what exactly you can do about it. It's not a guarantee. You will absolutely need to be consulting your own physicians. I'm not giving medical advice here today, but I do want to share with you what I've been seeing in my practice in the last couple of years of how we've been able to pull people out of thinking they had long hauler syndrome, people who've gotten COVID and not recovered fully. And we've also, I would say 70% of my practice chose to vaccinate, and maybe 5% of that 70% had poor reactions to the vaccines, some of them quite severe, and some of them just lingering, don't know why I don't feel right after that. So this talk pertains to both, and it also pertains to people who've not had COVID or the shots. It's just a generalized way to get a deeper understanding of what's in your body's way for healing and getting yourself back. So you're definitely not alone. You need to know that because sometimes it can feel lonely and hopeless. And I want you to know you're not alone and you're in the right place. You might learn some things today to help get yourself out of this. So imagine waking up rested, focused, and able to roll your day out with plenty of energy and interest in getting back to the things that you love and the things that you enjoy and, the things that make you you. Your ability to get back to work if you've lost work, show up for your kids if you're finding you can't go to events, that sort of thing. So before I go into some of the details of this, I wanted to just share a few case studies with you that are from my practice specifically. This is a 28-year-old patient. This was for her, it was post-shot for her. She had severe headaches that would not leave, poor focus. She couldn't be on computers for more than 30 minutes, so she had to pull back from a new job she had started that was very computer forward. For her, it was dealing with severe inflammation of her vascular system, and we'll be talking about that. But that was the main problem for her. Not just her inflammation, actually. She was so nervous about it that she also got into a state of fight or flight. And we'll be talking about the nervous system today. If you are stuck in fight or flight, it's very hard to heal anything. And we'll talk about that. So we had to calm her fight or flight so her body could come to a state of healing. And she was able to heal herself, move forward, and she was able to move out of state and start this new career that she was wanting to do. I've been involved with her family for years, so that was really a big deal for me. Not that it's all about me. Another case, a 58-year-old woman, severe brain fog and fatigue and poor digestion. For her, it was a combination. She had gotten COVID and recovered fairly well. And then she was trying to keep up to date. For her, the vaccines were important. And she got a second shot, and that kind of tipped her cart. She couldn't handle both. So she had severe brain fog, fatigue, poor digestion. She had to stop working and was worried that she was dealing with brain damage. She had gotten some CAT scans and everything was negative for her. In her case, it was a lot of gut clearing. The muscle testing we're going to talk about today drew our attention to her gut. And it was about cleansing her lymph. We'll talk about that as well as for her improving her fat digestion. Because she wasn't digesting her fat well, she also wasn't absorbing her nutrients very well. And that was giving her kind of poor digestive symptoms, as well as not being able to get the nutrients into her system to be able to heal. She's now 80% improved and is using our hyperbaric oxygen therapy that we have here in our center to keep clearing the information from her brain. It's a very specialized treatment that's not for everyone, but it is extremely helpful at clearing inflammation out of tough to reach places in the body. So we'll talk a bit about that. 42-year-old male. I'm just going to give you two more so you don't think I'm going on forever. This is a 42-year-old male. For him, it was just about recovering from COVID. Months of a chronic cough that would keep him awake at night. So fatigue was building. He was searching for words, and it was just this cough. He couldn't get rid of the cough, and it was disrupting his sleep. And for him, the muscle testing drew us to his liver and his lymph system and his colon. So his colon issues were causing lymph backup that was causing his upper respiratory system to be blocked from clearing. So now, once we followed the muscle testing guidance to understand how do we help this guy, he's now in full recovery. I really don't even see him anymore. He's doing great. Last one, 64-year-old male with chest pressure and blood pressure issues, super afraid he was having a heart attack. His cardiologists ruled out any thing like that. He wore a monitor for a while. That was not a problem. And Ellen, this will be recorded, so you can definitely listen to it later. I understand you're needing to leave a little early, so thank you for coming. I really appreciate it. So for the gentleman with the chest pressure, he ruled out, the pathologies with his primary care doctors. He also had a lot of stomach pain. It turned out for him to be his gallbladder and kidney imbalances. So we'll talk about how on earth could a liver or gallbladder or kidneys be causing heart stuff. But for him, we ended up helping his adrenal glands and thyroid, because he also was under a lot of stress. And the adrenals and thyroid are very involved in heart rhythms and helping the rhythms normalize in your heart. So for him, it was similar: clear the liver, thin the bile, get his gallbladder digesting fats better, and getting inflammation out of his blood vessels. And he's had a full recovery. He's continuing with hyperbaric oxygen therapy himself at this point. So what you're going to learn today is how hidden toxicities, food sensitivities, scar tissue, gut imbalances, and hidden infections can be a part of what's keeping you from recovering your energy and your vitality and your focus. I'm also going to be showing you how this dynamic technique called autonomic response testing, what it is and how it works, and how it gets us the specific information needed from your body directly, so we can build an individualized plan that you can get you out of this health situation. You have to be specific because everybody's so different. Your diet, your sleep, your emotions, your immune health before all of this. There's so many variables for why you might be stuck. So I love the ART, the autonomic response testing, for giving us direction on what to focus on first. Those of you that are still recovering from COVID and maybe a poor reaction to the shots, I'll be sharing the top 5 areas that need handling for achieving a deeper recovery. So we will get into those top 5 tips. We've helped so many people during this COVID experience to get back to health and not get hung up in the fear of having long haul or thinking they've got a COVID vaccine injury that's never going to clear. I want to try to give you as much insight as I can in the limited time that we have today together. I'll show you some options that you can have at the end of our talk if you want to take things further for getting rid of this stuff. But I want to share with you my screen because I'm going to show you, we're going to walk through a little bit of how this works. And please, if you have questions while I'm going along, you can type those to me in the chat because I want to make sure you get what you need while you're here today. Okay. Can you see that, Jen? Okay. So the autonomic response testing, we're just going to go through a little bit of it. Can it help your brain fog and fatigue? How does it work? So the first thing we do when people come in for an assessment, and I want you to know I'm not hung up on you coming in to see me. If it feels valuable to you, awesome. We'll see. We'll see you in here. If it's not your thing, I can help you find something that you can do. 1 second. Okay. I'm going to try to get through this with my voice, but if it's leaving me, we will email you for a reschedule. But I'm going to try. Okay. So if you were to come in for a session with me, we would reevaluate your nervous system. We're going to do a test called a heart rate variability test that lets us understand if your autonomic or involuntary nervous system is regulating properly. Because if that is off, your ability to heal will be interfered with. And also, my muscle testing will be less accurate. I'm having a hard time. Oh, there we go. So that autonomic response testing, I'm sorry, the HRV that we use, the heart rate variability that we use to evaluate your nervous system, that part of your nervous system is in charge of regulating digestion, immune system function, blood sugar levels, inflammation and tissue handling, heart rate, blood pressure. So it's very important that we first identify that that part of your nervous system is working properly. So that's the heart rate variability. Francine, can you hear me now? You could type in the chat if you still can't hear me. Is everyone else able to hear me?
Yes.
Okay, thank you. So back to the heart rate variability. Essentially, what we do is we have a heart rate monitor on your body. You lie down. At a certain point in the test, you're going to come up from lying down, and it lets me see if your nervous system made all the correct adjustments to a stress of standing up. So if that looks normal, we can proceed to the next step. My page down button is hassling me. Let's see. There we go. So things that can cause poor regulation with your nervous system and its ability to regulate. Hidden metal toxicities. You may not realize that aluminum from antiperspirant, lead from hair dye, chlorine, sorry, that's not a metal. Sometimes mercury from fillings or fish. And if this doesn't seem related to recovering from COVID or a vaccine problem or just getting rid of brain fog, if you have metal toxins that are creating imbalances in your detox system, when your immune system is fighting something as intense as COVID, your detox system really needs to be open and able to allow the toxicity from that immune event to leave your body. If it's hung up in your system and not leaving your body, it's part of what keeps people stuck. So metal toxicity, chemicals, we see things like chlorine from unfiltered water, scented stuff when you're doing a lot of Febreze and things like that. There are more examples, but I'm going to save my voice on that. Food sensitivities. You might think brown rice is great, but it's testing poorly for you in the session. So it's a healthy food, but it's creating inflammation for you. When I say immune challenges, I'm really talking about your gut microbiome. So people can have hidden bacterial or fungal problems in their guts. They can have low-grade parasitic issues that they're unaware of. They can be part of why your lymph system and detox pathways are also backed up. Scar tissue, that's an interesting one. They can be old or new. Typically, they're scars that came from injuries that needed stitches or surgical scars. Scar tissue can have an interfering effect on the nervous system's ability to regulate. So we pay attention to those when we're evaluating how do we free up your body to heal. The new stressor, which is more pertinent to this conversation, are the spike proteins. COVID virus, if you think of the virus as having an anatomy, part of its body has a spike cap on it, like a little spiky hat. And that spike protein is what sticks to the cells and allows the virus to go inside the cell and start infecting things. I'm going to mute for this siren. I usually make jokes with my patients that my ride is here when that sound goes off. So spike proteins, that little spike is what sticks to the blood vessels, the sinuses, the cells, and it allows the virus to infect things. The bigger issue with the spike proteins is, and I feel like this is the main issue that is getting missed in helping people recover. If your immune system has fought off COVID and you're on the other side of it now, but your body couldn't detox the spike proteins, it can be part of why the inflammation will not resolve. It can be why your detox pathways are hung up and keeping you stuck in a place of toxicity and inflammation. And I'm playing with my page down button again. Thankfully, I don't have a ton of slides. I don't know why it does that. Okay, I see. So step one was evaluating your autonomic or regulatory nervous system. Step two is the ART screening, the autonomic response testing. We use muscle testing to assess your whole body for weak acupuncture alarm points. These acupuncture alarm points are connected to your organs and glands. If I put moderate pressure on an alarm point, 1 second. I'm going to try to demonstrate this, but it's a small screen. So can you see my arm is up? So if I put pressure on your arm and it is strong, and then I go touch, let's say your sinuses, and the arm goes weak. I touch and the arm goes weak. I'm going through sinuses, tonsils, lungs, thyroid, adrenals. Any alarm point that goes weak tells us that that area is under stress. Doesn't mean it's diseased, but something is interfering with its function. So I brought my test kits to see if you can see this. So this is a homeopathic test kit. These vials are homeopathic tinctures of common metals. This one is common chemicals. I have one for fungus, parasites. These are frequencies of these items. Darn it. I'm so frustrated because usually I like to be very sing-songy when I present, and I'm being very careful here. So these test kits have also the frequencies of COVID, of the spike proteins, of some of the vaccine toxins. And we have Lyme, mold, and all kinds of things that we check. So if I touch over your lung reflex and your arm goes weak, I know this sounds crazy, but you'll have to trust me until I've been doing it for 22 years, tons of results. So you'll have to make a quantum physics leap of faith here. If I touch these reflexes and your arm goes weak, and I bring these frequencies into your field, and it changes that weak arm to strong, the fact that the change in the muscle strength happened tells me something in that kit is part of why you went weak. So we go vial by vial. Sometimes it's a food you're eating. Sometimes it's an unknown toxin you didn't realize, or it's a fungal problem. So if we can see who goes weak and then identify part of why, now we have something we can work with to design a specific plan for you to uncover how do we get you to move forward and get healing. So that's what that's about. Step 3 is what I just described. We use those test kits to find out the why. So step 2 is where are you weak? Step 3 is why. So you can then move. Let's say we picked up your liver tested weak and it pointed to mercury. Maybe you have dental fillings that are leaching, or maybe you eat a lot of mercury containing fish. Now that I know it's mercury bothering your liver, I can bring in whole food nutrients, herbs, other things into your field to see if it strengthens that weak reflex. So here we are at the lungs. You've tested weak. I brought my kit near you. It went strong. We went vial by vial and we saw it was mercury. So I'm going to test chlorella. That's something that can pull mercury. I bring it into your field. It does not strengthen the lungs. Great idea. Not going to work for you though. We check cilantro. Doesn't work. Bentonite clay. That works. That's what we're going to use for you. So we use the autonomic response testing to identify exactly what nutrients would be needed specific to you. Okay. Pardon me for 1 second. I so appreciate your patience with this. So, by the way, I thought I put a little picture of the spike protein in there. The spike protein, by the way, is super inflammatory, and it has a very high affinity or attraction to the linings of blood vessels. And I really think that is the biggest key for what has been being missed for understanding how to get a person out of their post-COVID or post-vaccine or just generalized fatigue and brain fog. So we can pick up on that spike protein with the muscle testing. And for one person, they might want nutrients that get inflammation out of the blood vessels so those spikes can release. For another person, it might be it's hung up in the liver. For someone else, it might be it's in the lymph of the colon. So there is no one size fits all protocol here. There never is in the work that I do for the last 22 years. But it's so powerful to be able to see where are we hung up and what's behind it and how do we move through it? What do we do to get it under control? So one of the tips is, and I'm going to give you some COVID specific things after this, but we have to identify the imbalances in your system, lingering spike proteins and toxins or whatever else, and design the clinically specific plan for removing them. And it can be done. I'm seeing it the last 2 years successfully. It is super easy to do. It's not without anybody who's worked with me knows it's work, and you are actually the one in the driver's seat. So we can help you get the answers of what's needed, and then we hold your hand and help you step by step to do what it takes to follow up and make sure that you get the results. Handling the liver, the lungs, the kidney inflammation in some people. It's using muscle testing to go see, again, I would say the top organs and systems that seem to be blocked from allowing a person to heal are the liver, primarily the liver. Second to the liver, I would say, is the lymph. The lymph system is, it's a fluid that is not in your arteries and veins. That's the cardiovascular system. Lymph is part of your immune system. So when your body is fighting COVID or trying to work through an event with the vaccines, your immune system shows up to kill stuff and takes the toxicity from killing those things and pushes it into your lymph system so that it can travel to the liver and the kidneys and the lungs to be filtered out of there. The toxins that came from a successful immune response need to get filtered through the liver, and the lymph is what carries those toxins to those detox organs. So if it's an event that is overwhelming to your body and your lymph is getting backed up, maybe your liver is no longer allowing the filtering to happen as well as it could be. With the liver backing up, as lymph tries to pass through it and can't go through very easily, it creates a back pressure that keeps things hung up in the sinuses and head and face, tonsils and lungs. This is the brain fog. You're just kind of sitting in a place of just inflammation and fullness. But for lots of people, they're blowing their nose and nothing's happening. They might be coughing, but a lot of people don't even have a cough. So why is this so stuck? And it seems to be downstream, clearing those detox pathways, opening up the circulation and the lymph, and we start to see the head and the lungs and the brain clear. Oh, I'm talking through my slides here. So yeah, the lymph, freeing up the lymph. By the way, if your lymph is backed up, you might have lymph nodes that you can feel or not. Your immune system starts to drop in its power because if it's killing things, but it has no place to put the debris, it starts to become encumbered. So you will see immune system weakness, got a cold again. Some people are getting COVID multiple times. I really feel what I've witnessed in here is if we can keep that lymph moving, it really empowers that immune system to stay up and awake and able to react, okay? So clearing inflammation from the blood vessels, super important. A lot of that happens with vitamin A and vitamin C. But again, it's different for everybody. We just need to use the muscle testing to get a clear information from your body specifically. How do we get inflammation out of the blood vessels? Because if circulation is compromised, it's very difficult to allow nutrients to get to the tissues for healing, and it's very difficult to get toxins out. So nutrients in and toxins out are baseline key things to achieve to get your body to move out of this place. And it can seem maybe like a small reward. Let me see, how do I want to say this? How could something like that be related to my cardiac disease? I'm having arrhythmias and chest pain, Okay, well, if the circulation is not allowing good blood flow to the heart, if your inflammation is causing stress in your body, and now the fight or flight system is going on, those are hard places to be to get your body to heal. We need that fight or flight to calm down. We need the inflammation to calm down, and we need to get the circulation rolling for cardiac disease, for diabetes, for gut recovery, all kinds of things. So it can seem like, nutrients and herbs and detoxing, how on earth can that be how I get out of this? I'm telling you, I promise you, it is extremely important to make sure that these areas, if they are having any sort of backup, that if we clear that, your chances improve greatly for clearing your health problem. The other thing is directly supporting the adrenal glands and the thyroid and the central nervous system, because this nervous system regulates everything: your healing, your sleep, your digestion. It also regulates your hormones. So there's like this tandem nervous system function regulating hormone function, which we get into the hormone glands, adrenal and thyroid, very related to heart issues, very related to sleep, very related to anxiety, a lot of things. So that has been an important part that I've noticed comes into a lot of people's plans as well. So I'm going to email, I wanted just to let you know, a lot of what I'm saying is a lot of words. So I was going to email each of you individually from my private account this sheet that will summarize what I have up here. So if you want to take notes, go ahead, but don't feel stressed out. I will be emailing this to you. If you want to try to start affecting the systems that we're talking about, the nervous system, the lymph, vasculature, the detox pathways, try this out for 10 days. It's something I've done throughout the years to help people reset their blood sugar and their sugar cravings. Because a lot of times when anyone's in here with a health concern of any kind, part of what's keeping them stuck is addiction to sugar. So if you can break that addiction, here's a factoid for you. 1 teaspoon of sugar, this makes me no friends, by the way, can suppress your immune system for 8 days. It's not like your immune system will be completely offline, but it will definitely be weaker. So hydration, can't say enough about it. When your immune system is fighting something, one of the things it instigates is causing you to have a fever, which helps fight the bugs. And fever can make you dehydrated. Dehydration can reduce the circulation and lymph that we need moving. So cannot say enough about hydration. Half your body weight in ounces per day of filtered water. Please don't drink unfiltered tap water. It has chlorine and those sorts of things in it that will sort of pull back the gift of drinking that much water. So sleep. That's something that's a big deal. I'm sure I don't have to tell you. 7 to 8 hours of sleep while you're sleeping is when your organs they go through a reset. So for organs and glands to function fully, you have to get into that deep REM sleep and allow them to come back to their baseline and be functioning higher for you the next day. Gentle exercise. If you're having a hard time, please don't push. You probably can anyway, but mobilizing your lymph and circulation with things like stretching, Tai Chi, walking, yoga, as long as it's not rigorous. So just gentle exercise, even if it's light weights at your house or something like that. You have to move your body, because if we're just laying around, even if you're feeling terrible, I would say low key 10, 15 minutes of moving your body as much as you can to mobilize these toxins through your body and get them out. Anti-inflammatory diet, super important. So reducing blatant sugars, processed foods, and dairy, I would say, are the top things. Again, I'll email you. We have a handout here at my office. It's called the Good Foods List. And it talks about when we say increase nutrient dense vegetables, what are we talking about? So blatant sugars like candy, cake, cookies, ice cream. Processed foods, even if they're gluten-free and organic, we're talking about bread, pasta, bagels, crackers, anything in a package. It's like you don't have to go to zero. Some people are in a health state where they're like, I'm going to zero. I support that. But if you're just kind of hung up and can't get out, and an intense change would be hard, you have a family, or it would be tricky, small moves matter. So do a food journal for yourself. Just write down what you eat, all of it. How much water are you drinking and what are you eating? And after about 3 days, go in and circle the sugar, the dairy, the processed foods. Let's say you did 3 days. If you circled up 15 things, that's 5 things a day. Could you knock it back to 2? So pick some things you could live without and reduce, because that can be a big change. Increasing nutrient dense foods so you can get some healing potential going. And again, I would share that list with you. Essentially, it's vegetables, low sugar fruits, healthy fats. Healthy fats are like, of course, I'm going to push for organic, clean farm stuff, because we don't want the GMOs and the pesticides and the antibiotics and the hormones to be in these foods for you. So butter, olive oil, coconut oil, the fat that's in eggs, healthy fats, quality clean farm proteins. If you're not vegetarian, chicken and fish and that sort of thing. If you are vegetarian, when I email you, you can email me back and I can give you some ideas of what to do there for proteins, nuts and seeds and beans and things like that. But again, as clean of food as possible, as far as like where it's coming from. So immune strengthening things. I'm still on the try it for 10 days. Intermittent fasting. There's a group of doctors who've been on the front lines treating COVID since it started. And one of the main things they talk about is intermittent fasting. If your body doesn't have to always be dealing with digesting food, it can turn its attention to clearing toxins, healing things. So intermittent fasting, what it means is if your last meal is like, let's say 6 p.m., just to pick a number. If your last meal is around 6 and you don't eat again until 6 a.m., that's a 12-hour fast. If you wait until 8, that's a 14-hour. Some people wait until 10 and get a 16-hour fast. So you don't have to fast during the day. It's really about waiting for that first meal, and that can mean smoothies and things like that as well. As soon as you bring in some food, it engages your digestive system. So trying to do intermittent fasting can be very helpful. I would say try it for 10 days. If you've never done it, just do the 12 hours. If that's your habit, 12 is what you're already doing, bump it to 14 and just see how you do. Avoid GMO and pesticide-laden foods as much as you can. Keep inflammation down. Find something to manage your stress. Like we were saying earlier, if your stress is up, it's going to get your fight or flight going. When fight or flight takes off, it blocks the healing part of your nervous system. So fight or flight goes up, it sort of pulls down the part of your nervous system that's there to regulate your healing. So it could be exercise, but if you're tired, it could be meditation. It could be listening to sound healing tapes. It could be talking with a friend. Again, when I email you, if this is an issue for you, I could give you a larger list of things to look at. Vitamin A and C from whole food supplements. This seems to be a really, really big part of it. By whole food, I mean, if you turn the bottle around and you look at the label, it has a lot of food items on the back. Instead of just vitamin A, vitamin C, how many milligrams? That's a lab derived. It's okay, but you would do better and absorb it more efficiently if it were coming from whole food. So vitamin A and C, usually at least 1,000 milligrams. Again, I can't give you medical advice here, but usually 1,000 milligrams. And if you feel like you're getting sick, you might bump it to 2,000. D3, if I had no other tool to help someone with COVID or their immune system in general, I would have them taking D3. One second. So D3, usually at least 1,000 IU. That's the measurement for D3. Most people are testing for 2,000 to 3,000, sometimes 4,000 to 5,000. But again, you must consult someone on that before you get into that for yourself. Zinc is another one. Zinc can stop viruses from replicating. So it's a very important nutrient for prevention, as well as if you've gotten sick and you want to get a leg up, you would increase the zinc, and how much is different for everyone. There's a whole protocol that I won't list here today because it's not the same for everyone. But there are other more intricate nutrients that have been identified as being specific to helping with COVID. And not everyone tests for wanting all of them, so I don't want to advise you to go buy all these and take them. But quercetin helps zinc get into the cells so zinc can block viruses. NAC is something that can help the lungs, upper respiratory. Melatonin has proven to reduce the severity of COVID by up to 80% in some people. So there are a number of nutrients that we would test for people to see if they seem to be appropriate for helping you prevent and also get yourself out of COVID if you do run into it. All right. I feel like we've talked about, the things that can be in people's way for healing. We've talked about things you can do to get started. We've talked about, if you want my help, you can certainly come talk with me. But I wanted to open it up for just a second for Q&A, mostly so I can stop talking, but also so I can hear. If you have questions for me, you can unmute yourself, please. And feel free to ask me questions because I realize I've just been presenting.
Hey, Dr. Susie, Colby
Yes.
here. Would you include honey in the no sugar idea?
Not as much. Honey and honey and maple syrup are usually get a pass. But yeah.
Would you like to talk about K2 and blood clotting a little bit?
Sure. So again, very individual for each person. D3 with K2, the K2 helps people absorb the D3. For anyone who's currently dealing with blood clotting, it's generally not advised, as you might know, to take K2 because it helps the platelets, which are the cells that can help you clot. Let's say you cut yourself. Platelets come and help you stop the bleeding. So K2 supports those platelets to be healthy. If you were taking mega doses of K2, I would be concerned about that having a poor effect on dealing with clotting. So if someone has done medical testing and seen that they have clots on ultrasound or a blood lab called D-dimer that demonstrates clotting is present, if you were taking a D3 with K2, I would probably separate them out. I would have you do just the D3 without the K2 until I really don't feel like it would be a problem. That said, why not err on the side of caution, wait till those D-dimer tests are negative, or the ultrasounds are showing that you're clear. So does that answer your question? Was that enough of an answer, Colby?
Yes, sorry, I was muted.
No worries.
That's great. Thank you.
Okay, sure. Anyone else? Not so much. All right, let me see if I missed anything I wanted to tell you. No, I think I pretty much covered all the points I wanted to make. Well, let's see here. So for any of you that might want to come in, and I recognize some names here that are people who already know this work. If you would like a consult call with me, please feel free. So I was going to offer a free 10-minute consultation. I'm sure I'll have my voice cleared by then. So if you don't feel like you have enough information to warrant coming in to do a first session to check this out, feel free to respond to the email I'm going to send you, and my staff will be in touch to invite you to schedule a 10-minute consultation with me. The other thing that I wanted to try to help with, you can tell me during this call what your health issues are, what your questions are about this approach, and any other questions I might be able to answer for you. The other thing I want to offer is a discounted initial session. It's usually $245 for $125. We do a full timeline health history to see what's been happening, what have you tried. We do the HRV test. We look at your food journal that we ask you to do before you get here and kind of take a look at things and give you some advice around your food. We do the full ART, the autonomic response testing screening, to see where you're testing weak and get some ideas about why. And then we demonstrate for you how we use the muscle testing to build through nutrients and herbs and things like that. How would you get started? So I really don't have too much more to share with you that's specific. I really just, it has been so important to me to share, and I'm trying to also do this for our practitioners here in the Vermont area. When I'm watching my patients come in who are struggling and stuck with brain fatigue, brain fog, focus problems, poor sleep, all the stuff we've talked about, and now they're on blood pressure meds, now they're on diabetic meds, and their docs are not aware that this stuff I'm seeing, and many of my colleagues also, I don't know how else to get the information out to people. So I haven't done talks in years. I used to do 3 talks a month for years. And even before COVID, I had stopped doing talks. I just kind of got too busy. And this has been so important to my heart to try to get information in people's hands to know that you're not stuck. There is hope for you. I've seen it with my own eyes. And I'm hoping to be able to bring this information to my colleagues, primary care physicians and naturopaths, to open the vault a little bit on another angle, a deeper look, so that we can get people out of trouble, reduce the fear, and get immune systems built. That's the other thing. Once we get people out of trouble with their symptoms, it's all about getting your health to a sweet spot. So your immune system's strong. You've been sick, so you've got the antibodies. There's a lot of things to talk about there, but I really appreciate you coming here today and letting me share this data with you and getting through this froggy voice that I have. So thank you for being here with me. And if you have other questions, I'll hang out here for a second. And if you don't, please watch for the email that I'll be sending out that can offer you some other ways to connect and ask deeper questions. Any other questions for the moment?
Hey, Dr. Susie,
Yeah.
um, there's been some talk about microclotting. Any thoughts in that area?
Mhm. I have no doubt in my mind that microclotting is happening, either with COVID or the shots. I would say a tiny bit more, not so tiny, maybe more with the vaccines, because when you breathe in the COVID virus, you probably are breathing in, let's just pick a number, thousands of spike proteins. When you get the shots, there are billions of them, and they do hook to the linings of blood vessels. So now you have a spike protein that is adhered to the lining of the blood vessel. Blood is flowing by, and some of the red blood cells may get injured by the spike protein. When a blood cell is injured like that, it sets off the platelet or clotting system. The body's like, ooh, we might be bleeding. I should start clotting. So I don't believe the microclotting is showing up in medical testing. Unless you did a deep angiogram, which is a dye-based test, scan of the head or elsewhere. In the muscle testing, we've been able to pick up that people are dealing with vascular issues. If their body tests for vitamin A and C to get inflammation out of the blood vessel, to me, that's like maybe not clotting, maybe that's just inflammation and poor circulation. If they test for high dose serrapeptase or nattokinase, these are enzymes that are used specifically for breaking down fibrin, which is part of the clot. So if I find that vasculature is showing up in a person's testing, and the nutrient that tests to reverse the imbalance is something that is used for clots, I'm thinking there's clots. And I've had a lot of people, not a lot, I've had a handful, get tested, be told there's no clotting, and we pick this up and we treat it as if there is clotting. And the other part of that is just really making sure that we're opening the detox pathways. There are very specific nutrients. This comes from a dear mentor of mine, 50 years in practice, Dietrich Klinghardt. He's a German physician who's been on the ground for years, and he and his colleagues, he's in London, he has friends from all over the world that are in their own practices or in the ERs. They have witnessed certain products, herbs, and other things that will allow people to bind and remove the spike proteins. So binding and removing the spike proteins, as well as different protocols that can help with thinning the blood to break up the clots. And generally, I'm co-treating with a primary care physician or naturopath with these things to make sure we're collaborating and keeping people safe. So,
Cool, thank you.
absolutely. Anyone else? Well, I hope that you found value in this. I really love what I do. I hope I get to help you. Or, again, if you're don't live near, or this isn't really your cup of tea with muscle testing, I think it would still be worth a phone call, because I might be able to help you find a way to take some of this information in your own genre to assist yourself. Okay, if there aren't any more questions, thank you very much, and watch for our email.
Thanks, Dr. Susan.
Absolutely.
Bye-bye.
Bye-bye. Danielle, is it Danielle? Did you have additional questions? Or Linda? Okay. Thanks very much for coming.